and stop spreading infections is our major vision, is our major responsibility. And all of us, in each person in the healthcare facility or in the community, in houses, in banks, in hotels, in everywhere, this is a personal responsibility. If you did take care about implementing these small steps, you will make a huge difference in the futures for you, for your patients, for your family at home, and for your colleagues, and for all the world. So infection control is concerned in the healthcare facility for all staff, starting from the security, administration, doctors, nurses, ER, radiology, laboratory, pharmacy, critical care areas, oncology, delivery room, OR, maintenance, and even housekeeping. All or each staff in the healthcare facility needs to know principles of infection control in its own field or own office or own area that will help to prevent the infection as much as the staff can. Some facilities doesn't provide PPEs or sanitizers or hand dispensers or soap near to the sinks or towels to dry the hands. So as much as we can, we have to find some solutions to stop the spreading of infections. I'm sorry for the people that want me to talk in the lecture with the Arabic version. But fair enough for all of you. You will also take the lectures for your future. I have to speak in English for all of us. I will accept your questions anywhere on the WhatsApp. I will send my number. I will send my social media accounts, and you can ask me in Arabic, or I will explain to you in Arabic anytime that you want. If you are really loving the field, if you feeling that you are responsible, that you know that you need to learn about the prevention of infections, I'm willing to answer you anytime, anywhere. So the role of infection control is all about monitoring, auditing. That's why people hate the infection control staff. Following up healthcare-associated infections, which I will explain, in preventing outbreak diseases through or by implementation of policies, procedures submitted with active surveillance, with continuous education, with general practices of infection control, which will lead us to develop the hospital epidemiology and infection control programs. So these small attitude in implementing the infection control practices will help us as an infection control staff. So if you want to act with your policy, with the facility of your with the policies in your facility, you will help all the staff, you will help all your colleagues, you will help the patient to stay as less as it can be better for him. So all of us knows this is not normal or not from the patient safety policies that the patient can stay at home. He can get infected from staff hands, from environmental cleaning, from segregation of waste, or misuse of antibiotics, or ignoring some instructions. So we need the patient to be in the hospital for the urgent need only, not for all the time, not for the money, not for neglecting the patient's right. That's why we implement infection control practices. So in a humanity manner, we have to be responsible to take care of our patients and prevent infections as much as we can. We are still in the role of infection control. What do we do in our departments? We do surveillance with feedback of infection control rates in hospitals, especially in critical care areas. We do enforcement of preventative practices. We do supervising to collect and analyze surveillance data. So we know how many infections in our hospitals, how many infections in the ICU, in the PICU, in the NICU, also in the delivery room, also in the surgical ward or telemetry. We have to count it. So after counting, we will do a surveillance and we will know how many infections in our hospital, what to do to prevent these infections in the next month. How can we stop spreading of infections before it will happen? Also, we do involvement of the physician and the lab, microbiologist, and also the pharmacy, also the maintenance, also the housekeeping, and for sure our nurses, and the patient also opinion in preventing and education, the patient education materials. So all of these steps will help us to control if, the infections inside our hospital and prevent future infections. If we did at least the 4 points here, the 4 most important here in the infection control of our hospital, the programs will elements and the programs with these elements will reduce rates at least of healthcare associated infections at least by 32% or more in our hospitals. As much as we make efforts, we will prevent infections. Also, this is coming from the effectiveness of surveillance and the accurate data that we collect. If we don't care about our infections, we will make the hospital a bad area or a bad environment to receive more patients. And in the future, the healthcare facility will lose the benefits of opening this healthcare facility and will lose their staffs, and they will lose the trust of the people if there is more infections than it should be usual. On the other side, if you did collect some data and you did the surveillance in the infection control department by their staff, and you found that there is no infections, 0 infections, there is something wrong. You have to know and make sure that there is something wrong. There is no hospital without any infections going on their policies and procedures with the right implementation. So when you found that there is no infections in the hospital, that means there is something wrong. Either the data is missing, the data is wrong, the collecting is wrong, something is hiding behind the staff. They are hiding something, they are maybe lying, or they are maybe not telling the truth, or maybe they failed in their missions. So we have at least 2%, 3%, 5%, I'm not sure, but at least we should have some infections in the hospital to make sure that you are counting, you are following up. So be aware about this point. The role of infection control is still growing, and now we have a worldwide reputation about our vision, about our implementation, about the importance of being or doing the infection control practices. And for the sake of all of us, this will increase the risks on our patients or on our families, on our children or immunocompromised patients. And this also will make the healthcare costs are less than usual or it used to be. So implementing prevention practices will complete our mission and goals. Not only surveillance, not only auditing, not only monitoring, not only catching mistakes, not only deducting from salary. We need to prevent infections. This is our major goal. Then we will do other steps to help reduce infection. I hope it's clear. About the healthcare associated infections, what do we mean about healthcare associated infections? Infections are happening in the hospital, in the facility, in the clinic, in the dental clinic, in the Cosmo clinic, also in the delivery room. It's in the hospital. It's because of the practices of the staff. Some infections coming from outside the community to the hospital. So we will not count it as healthcare associated infections. We should differentiate between the healthcare associated infections and community acquired infections that comes to us from outside, from the community. Someone with chickenpox from the community coming to the facility, doing a surgery, or admitted for high fever or some deteriorating situation. And if we did not take the right precautions for this patient, the chickenpox will spread in the hospital and will lead us to more more complicated situations for now and for the futures. So the healthcare associated infections counted in the hospital after admission, after admitting the patient. Some infections are happened in the ICUs, in the surgical ward, or whatever we found it. And we will explain more about the infections that comes from sharp injuries and also from the wrong segregation of waste management later. So the healthcare associated infections pose a grave risk to patients, clients, staff, visitors, and also for housekeeping, which had a major complications about the insurance coverage, about their psychological situation, and this will lead us to bad environmental cleaning, also getting rid of the waste, and etc. Healthcare associated infections cause significant morbidity and mortality for those infected and increase the cost of care provided to the patient due to the extended hospitalization and the use of restricted drugs. We have too much or so many reasons for healthcare associated infections. We will try to count it now in our lecture so you will know it. And then you will know if you did implement the infection control practices and read the policy and follow up the policy and ask questions to explain what should I do to prevent the MDROs, which is multi-drug resistant organisms. Because resistant of bacteria will lead to more infections, will lead to the extended hospitalization of the patient. So the healthcare cost will be raised. You have to know about these points also, that antibiotic use, the right use for the antibiotics will reduce the healthcare associated infection, will reduce the days for the patient to stay at the hospital, at the facility, will make him deteriorated better than or more than recover in our hospital. This is a responsibility. You have to know also ignoring wearing the precautions will make the staff a point which with the infection transfer from the patient to the staff, to his colleague, to other patients. So this circle will never end. That's why we implement infection control practices to stop and cut or break the chain of infection. So those practices will make the morbidity and mortality less than expected, less than before, less than usual. So this is um, in our benefits, in our reputation, also in receiving high quality of receiving and providing high quality of services to our facility. So you will not lose the informations. You will find it also, and usually you will always find it in the policy. When you will read the policy, you will know the basics. You will know what to do in your department as infection control practices and responsibilities, and then you will understand by practicing and by the time by practicing the infection control practices, you will understand why we should wear precautions, why we should do hand hygiene, why we should segregate waste, why we should discard the sharps in the sharp box, why should we do the environmental cleaning in a special way, and etc. So the healthcare associated infections are happening only after admission of the patient. And it comes only for patients or staff. If we did not practice the prevention practices, we will spread the infection, and we will in the outbreaks or the infections that are spreading quickly, like the COVID-19 or influenza or TB, we will make a huge responsibility on ourselves and on our patients, on our facility, and we will get tired for a long time, and we will not get rid of the outbreak as soon or as much as is it's easy as it sounds. Practically, it's not that easy. It's very difficult for all hospital staff. Healthcare associated infections can happen in our hospital as a direct result of treatment or contact with health or social care setting. Let me give you an example. A patient has a flu. I have to wear a precaution as a staff, a surgical mask, and the gloves. Before wearing a gloves, I should wash my hands. If my hands was clean, I have to use the alcohol-based hand rub to reduce the microbial count on my hand, and then I will wear the glove. If I didn't wear the glove, if I didn't sanitize my hand, I didn't wash my hand, I will touch the patient, and then I will finish the procedure that I was doing with the patient. I will go out from this room, and then I will transfer the flu virus particles, which I cannot see by my own eyes, to the door, to the office, to the keyboard, shaking hand my friend or my colleague, my relative, whatever. I will transfer this virus with this practice. So as a direct result of treatment, after procedure, after aseptic technique, after doing any aseptic technique, after exposure to body fluids, after an operation, or after whatever, if I did treatment for one patient without taking precautions or infection control practices, I will spread the infection. So the infection will go from one room to another, from one patient to another, from patient to staff, from staff to the other patient. Also, healthcare-associated infections counts as a result, as a direct result of healthcare delivery in the community. As we said, if we had a chicken box from outside, from the community, and the patient was admitted for any reason, for any situation, and the staff didn't wear the precautions, chickenpox need contact precautions because it's spread by direct contact, touching the skin, direct contact between the staff and the patient. So if I wasn't wearing the contact precautions, which is gloves, or first, hand hygiene, gown, face shield or mask, goggles, gloves, if I wasn't wearing any of these and the patient has a chickenpox and I wasn't I wasn't careful enough to prevent the infection will spread in the hospital or the healthcare facility, and it will lead us to an outbreak of chickenpox. Chickenpox, in some references, counted as an airborne precautions in some severe conditions. So I have also to wear contact precautions and airborne precautions, which is the N95 mask, because it can spread by air particles, which I cannot see by my own eyes. I don't have to see microorganisms by my own eyes to take precautions. Microorganisms in general, you can see it under the microscope. So don't waste your time. You have to change your beliefs that you have to see something to take precaution. No, you have to take precaution even if you see or you didn't see anything. You need to know that if the patient has an infectious disease, infectious microorganism, whatever, you have to take precautions for your safety as a staff. Second, and for the patient safety first. Healthcare-associated infections also as a result of an infection initially acquired outside the healthcare facility or healthcare setting and taken into the healthcare setting by patient, staff, or visitor, as we mentioned in the example before. Healthcare-associated infections, most in the hospital or healthcare or clinics or whatever facility that provide healthcare, is more coming from the infections on patients that has devices, more in critical care areas. Devices like urinary catheter, indwelling urinary catheter, or mechanical ventilator, or central line. These are the most infectious microorganisms. Beside the patient situation or other situation, like in the burn unit, in the oncology, immunocompromised patient, organ transplant, also patients who has meningitis, who had TB, who had malaria, who had measles. These are more major infections. But if our facility was clean without any infections, the infections may be coming from the devices. If it's not sterilized enough and cleaned enough, disinfected enough in the CSSD department. What type of healthcare-associated infections can be in the hospitals? All of the microorganisms, but most famous is the MRSA. The MSSA, we count it as MDRO, which is multi-drug resistant organism. But MSSA, methylene sensitive Staphylococcus aureus, counted as healthcare-associated infections because it doesn't come from environmental cleaning or from environmental services or from indwelling devices. No, it comes or transfer from unclean hands, from patient or from staff doesn't clean or wash or sanitize their hands. Also C. diff, also E. coli, also Pseudomonas, Candida, norovirus, which can be used or present after confirming from the lab in the urine, blood, sputum, tracheal aspirate, wound, air, stool, and body fluids, and whatever sample I can take. We can find these microorganisms as a healthcare, as defined as the healthcare associated infections. As I said before, most healthcare associated infections are associated with the devices, such as indwelling urinary catheter, intravascular catheter, mechanical ventilators. Anything can enter the body through the mucosal membrane. And beyond these risk factors, exposure to the ICU, also the use of other devices like nasogastric tube. This tube might be um, not disinfected in the correct way, or not sterilized and labeled in the correct way. So there is something wrong, but it's still in the healthcare facility. Also, antimicrobial exposure, as I said before, the misuse of antibiotics can lead the microorganism after infection to be resistant for the bacteria. Resistant for the antibiotic. If I had the patient with meningitis, let's say he had Neisseria meningitis. If I give him the wrong antibiotic or the wrong duration of the antibiotic, the wrong time of the antibiotic, this Neisseria meningitis will make a resistant to this wrong antibiotic, which will make the patient deteriorated in the same situation or a worse situation, and he will stay for a long time in the hospital, which will lead to a more time to get healed and a high cost on his insurance or on his own side, and will lead us to make more effort from our staff to take care of him. So this is not the right way of preventing infection, which is prescribing the wrong medication or the misuse of antimicrobials to the infected patients. So we, in the antimicrobial stewardship, we had a basic goal, which is prescribing the right antibiotic for the right patient with the right dose and the right duration at the right time. We have to take care of these points because misuse of antibiotics will lead us to multi-drug resistant organisms or antimicrobial resistance. So we would need more time for the patient to heal, and more cost and more effort from the staff. Also, some elements will attract healthcare associated infections in the hospital. Extremes of age and underlying illness all increase the risk of healthcare associated infections. Importance of infection control. Implementing the infection control practices will reduce the risk of healthcare associated infections, as I mentioned before, will reduce the percentage of morbidity and mortality as much as we can, will reduce the costs healthcare services due to the duration of hospitalization of the patient. If he gets healed faster, we will not make the insurance pay for more money. Reduce urgent risk problems and challenges of healthcare delivery. We will try to stop the spread of one case of chickenpox. Instead of receiving outbreak, we will finish this chickenpox case and we will let this patient discharged in a perfect way, so there is no infection. Or if we did ignore the precautions of infection control, we will have an outbreak of chickenpox, and this situation cannot be handled easily. So we will implement the infection control practices to prevent outbreaks, prevent future outbreaks, prevent more challenges that we are not ready for at this moment. All of these uses to improve environmental cleaning, improve effective communication between staff. All of them are exchanging policies, exchanging information, exchanging experiences, and also advices, and also answering some questions. Someone is expert from the infection control is not as someone is new beginner in the infection control. Also will improve the safety of high alert medication. We will know this in the using of in the misuse of antibiotics as drugs. Also will improve the surgical sterile processing. When we stop or audit the CSSD department, التعقيم الطبي, when we audit it and we found some instruments are not cleaned enough, and we will stop that procedure exactly, we will stop spreading the infections or microorganisms that can be still in the instrument without any cleaning or the right disinfection or the right sterilization. So we will improve our surgical sterile processing. طيب, let me ask you some questions. So we will review what did we say, and you can answer in the chat. Yes. Can I go to the last slide? Which one, ya Noda? The one about MRSA, the microorganisms. This one, MRSA, this is methicillin-resistant staphylococcus. It is a microorganism called staphylococcus resistant to the methicillin. Methicillin, it's an antibiotic. MSSA, sensitive to methicillin. So we count it as healthcare-associated infections. But most dangerous, MRSA, which is transferred between staff and patients on hands. If we didn't practice the hand washing or hand hygiene properly, we will transfer this MRSA. طيب, let us ask some questions. First question, the answer is it does care about community. Can you clarify your question, ya Ragad? She's asking about my question, sorry. Infection control practices doesn't care about health, about community health. What do you think? It does care. Yes, it does care. As we said, it's a circle. When we start with one person, to the staff, to the outside, to the healthcare, to the housekeeping, to the maintenance, to the security guy, to the taxi that I was sitting in, to my family at home. So this is dangerous. If we did not take care about the infections in the healthcare facility, we will spread it outside. So no, infection control practices does care about the community health. Second question, infection control plays a huge role in improving hospital quality. What do you think? Yes, correct. Environmental cleaning, waste segregation, also using the correct PPE, also hand washing or hand hygiene. All of these are elements that will lead us to a higher quality in our in taking care of our patients. Yes, it is also effect to reduce costs. Yes, so these are quality goals. Third question, healthcare-associated infections, most caused by medical devices. What do you think? Yes, it's true. As we said, the medical devices attracts the microorganisms. And if it wasn't sterilized enough in the correct way, will make it as a good environment for the bacteria to grow and make a good home and stay enough. So healthcare-associated infections most caused by medical devices, which is indwelling urinary catheter, mechanical ventilators, and also central lines. Yes, like in ventilators, yes, true. Fourth question, prevention practices help reduce healthcare-associated infections in hospitals. I think it's easy. Yes, hand washing before and after anything, yes. Prevention practices help reduce healthcare-associated infections in hospitals, yes. See, all of you can answer in English, can understand in English. And this is for مصلحتكم. Last question, antimicrobial resistance help increase healthcare-associated infections in hospitals. What do you think? Yes. As we said before, يلا عشان أبرد قلوبكم أشرحها بالعربي. I did explain this in English. الميكروب أو أو البكتيريا أو الفيروس إذا تم علاجه بالمضاد الخاطئ إيش يصير فيه؟ يعاند. it will resist, make a resistant. يقول لك تديني وصفة خطأ، أنا تديني وصفة خطأ، لا أنا أوريكي أصير مقاوم وأتكاثر أكثر وأصير أذكى منك ومن هذا المضاد. يعني أخلي حالة المريض متدهورة وبسرعة، يخلي حالة المريض في حالة حرجة، فحتى ما يعني هو ما تعالج ولا قدر يحافظ على الوضع الصحي اللي كان فيه، فتصير حالته deteriorated. The microorganisms are very smart. So when you do prescribe the wrong medication, it will make a resistance. So antimicrobial resistance help increase healthcare-associated infections in hospitals. That's why we have to minimize the use of antibiotics, and that's why وزارة الصحة والتعاميم جاتنا فيما يخص الحد من استخدام المضادات الحيوية، لأنها ما هي في مصلحة المريض أبداً أبداً أبداً، بتجي على صحته. طيب يلا خلينا نشوف let's see general practices of infection control. إن شاء الله تكون المحاضرة يعني خفيفة عليكم يعني وشرحي واضح. I hope يعني it gets easy for you to understand. General practices of infection control. Basics of infection control. ما فيها لعب. Infection control. Many healthcare associated infections and community acquired infections يعني اللي which is inside or outside the hospitals are preventable. نقدر يعني we can stop it. We can through the use of best practices in infection and prevention and control. When we implement practices and best practices, we can prevent many diseases. How can we prevent? So general practices of infection control and mandatory and basics to stop spreading the infection or prevent the infections before it happens. First of all, hand hygiene. Precautions. Environmental cleaning. Vaccination. And the right use of medication and continuous education. Let's say we have updated information about COVID-19. You will know it from the administration of your hospital or from the infection control department. You need to sign your vacation of COVID-19, you have to go to infection control department. You need to take permission if you are pregnant to take a special vaccine. You have to go to infection control department. You need to learn the correct sequence of donning on doffing PPE. You have to go to infection control. You need to know about your situation after vaccination, before vaccination, and for example, you need to know special information about this infectious microorganism. You have to go to the education nursing department or infection control department. So this is easy. Sometimes we ignore small elements about infection control, but it's easy. In general, we have to do these things or these elements to know that we are in the correct pathway. طيب, let's talk a little about hand hygiene, which is very easy. We have 3 types of hand hygiene, but first I need to say that it's a way of cleaning hands that reduce potential pathogens, harmful microorganisms. We have something called microorganisms and pathogens. Why did we put them into different teams? Microorganisms are the usual name of small organisms that live around us and inside our bodies. We call it pathogens when it's infectious. And some microorganisms are normally to be in my stomach, in my mouth, in my eye, in my ear. We call it in infection control normal flora. This is part of the organ, part of my kidney, part of my heart, part of my skin. These are normal flora. These are normal microorganisms. A microorganism, when it's transferred to be infectious, so this is our enemy, we call it pathogen. يعدي علي كده وما أسميه اسم، لا أنا أوريه، حقول عليه كائن معدي، ما حأشرفه باسمه العادي microorganism. So I will not call him microorganism anymore. He's a pathogen, he's an enemy. So hand hygiene is considered as a primary measure to reduce the risk of transmitting the infections among patients and healthcare personnel. We do have 3 types of hand hygiene: hand washing, hand rubbing, surgical scrubbing. Hand washing, we do it or perform it when our hands are visibly not clean with water and soap, the duration from 30 to 60 seconds. I can give you permission, if you did forget the steps, please cheat from the poster. You have a poster. في poster فوق كل حوض، في poster تحت كل dispenser. Cheat from the poster. At least cover all the areas in your hands to do the hand hygiene properly. Okay? Hand rubbing, we perform it to reduce bacterial count on our hands. I know that my hands are clean, but to make sure to be more sanitized, I will use hand rubbing. We use alcohol-based hand rub for hand rubbing for 20 to 40 seconds. So it's half of the duration of the hand washing. And you can find dispensers everywhere in your hospitals. If you did not find it, please inform the infection control to please put a device of alcohol-based hand rub or a dispenser for us in this area. Please, it will make us it will make it easier for us to go far away and sanitize our hands there. Please put one device for our department here. I hope that they are cooperative with you. And then we have surgical scrubbing for staff only in the OR, and we use water, soap, and sponge, and the duration from 3 to 5 minutes because it has a special steps. It needs longer time. How to perform hand hygiene, how to hand wash and hand rub. These are posters supposed to be beside each sink, beside the entrance of the area, in the center of the patient room, in the center of the hallway. Please inform your infection control department to put these posters beside the hand washing sinks and the hand sanitizing dispensers. And as I said, if you forget the steps, it's easy for you. Cheat, please cheat, and tell your friends. I had some videos, but unfortunately it will not work here. When to perform hand hygiene. To make it easy, let us divide it into two sections. 2 before, 3 afters. 2 befores, 3 afters. 2 before for the patient's safety, to protect the patient from me as a staff. Maybe I had an infectious microorganism, wallahu a'lam. 2 before, to protect the patient from me, before touching a patient, before a septic procedure. I have to perform hand hygiene. 3 afters, to protect me from the patient. Yes? Do you agree? 3 afters, to protect me as a staff from the patient. After exposure to body fluids, maybe the patient had salmonella or chickenpox or whatever. Body fluids will contain infectious microorganisms, will transfer to me. So after exposure to body fluids, I have to perform hand hygiene. After touching a patient, in general, I have to wash my hand. I have to sanitize, wash my hand, أحسن, to protect me from the patient. After touching patient surroundings, when I'm coming out, when خارجة قال لي أعطيني جوالي. When I'm coming out, he asked me to give him his mobile. His mobile has an infectious microorganism. What to do? After touching patient surroundings, I have to wash my hands. So نقسمها كده. 2 before, to protect the patient from me. 3 after, to protect me from the patient. Fair enough. I will send also the links of the video so you can find it later. I don't know where, in the WhatsApp group or whatever. I will give you also the my accounts on the social media, so you can ask me whenever, whatever you want. Said is saying, instead of cheat, use learn. We know sometimes the steps are too much pressure on the nurses. I'm not on their side. I know they have to memorize it as much as they can, the steps of hand hygiene. Sometimes I am in a hurry. My car is waiting. My family is waiting. Sometimes I'm very hungry. I need to eat. Sometimes I am finishing